Coco and Teal.
Welcome to another episode of Coco and Teal Speech Therapy. I'm Teal. This is Coco. When working with a child with cleft lip and palate, we can divide our treatment goals into pre-op and post-op goals. Ideally, the surgery for repairing a cleft lip happens around 12 weeks or 3 months, and the repair for the palate happens around 9 months of age. According to a journal article in the Cleft Palate Craniofacial Journal, the top 3 concerns that parents mention pre-op for their child with cleft lip or palate are feeding, sleep, and development. Obviously, feeding is an inherent challenge for this population. With cleft lip and or palate, there is a fistula or hole either in the lip or on the top palate inside their mouth. And this, of course, leads to feeding challenges. Whether the child is breast or bottle feeding, we need to be sure to position them in a more upright position than we would for a typical baby. In addition, many parents end up needing to use specific modified nipples. Boiling the nipple to make it soft actually allows the parent to control the flow a little bit more. And this is important for feeding a baby with cleft lip and palate because if they end up with too much liquid in their mouth, this leads to aspiration and choking or having the milk come up through the fistula in the top of the palate and out through their nose. So pre-op, most of your goals as an SLP will focus on feeding and making sure that that baby is able to consume calories and grow in order to be strong enough to be a solid candidate for these surgeries as soon as possible. I also make sure I'm encouraging parents to pursue appropriate speech and language goals, even pre-op. Anatomically, physiologically, we know that a baby with a cleft lip and or palate is not going to be able to produce certain sounds. Pressure consonants are the sounds that are anatomically or structurally impossible for kids with cleft palate to make. Pressure consonant sounds include B, P, D, and T. Because there is a hole either in the child's lip or palate, these sounds simply will not come out correctly until after the surgery. So use all the language strategies that we would use with any typical infant. Talk to your child throughout the day, label things, use gestures and an animated face to make them interested in listening to your words. On the speech side of things, we should definitely be encouraging these babies to babble, but we need to keep in mind which are reasonable targets to model for babbling. The most common disappointment for new dads when their baby has cleft palate is unfortunately dada features a sound that is going to be distorted for any baby with a cleft palate. Because of the hole in the top of their palate, dada is going to come out hypernasal, maybe even closer to na-na. So some therapists recommend that dads provide their name in these early days, weeks, and months of life as Nana instead of Dada, because Nana actually has the exact same tongue placement as Dada. However, it's a more realistic sound that kids can easily make, allowing for that extra nasal airflow. Under 9 months anyway, besides promoting babbling, my main language goals would focus on receptive language and social skills anyway. So I think these are really important language targets for a therapist or a parent to have for their child pre-op. Thanks for watching this week's episode of Coco and Teal Speech Therapy. If you're a parent or professional with some hot tips or info that I didn't mention in this video, please comment below and share what you know. See you next week.